back to another edition of Surviving and Thriving in a Pandemic. I am your host, Pastor Sharice Cross, and I am so grateful that you have tuned in today. I hope that you are blessed by what we're going to speak about today. Listen, if you can, go ahead and press that share button. Share this, let your friends know, let Lottie Dottie and everybody know that we're on today, and we have a great resource for you again on surviving and thriving in a pandemic. I have two beautiful souls here today that are going to share about community care and home health care. We have Beverly Roberts. She is here, and she is a nurse, and she's going to share about home health care. And then we also have Shanice Tucker, and she is going to share with us about community care. So a lot of information to talk about today, and I'm thankful that you're both on the show. Welcome.
Thank you. Thank you for having us.
Thanks for having us.
All right. So let's start with community care.
Okay.
Let's start with community care.
We have two Medicaid waiver programs within our organization. It's SOURCE and also CCSP. And it's a program for folks who meet nursing home level of care, which is a community-based program for individuals who have a physical impairment and or a cognitive impairment to help them in their homes. We provide services for children and adults. And it allows us to be able to provide a service to you in your home, in your own domain, that focuses on ADLs, focuses on home delivered meals, focus on adult day health, skilled nursing for people who have issues in getting their medication pill boxes set up. And then also we have the emergency response system, which is the medical alert button. So it's a program that I think that is guaranteed for anyone who may need assistance in their home. And also that just oversight to help them with just their everyday living.
Mm-hmm. Oh, wow. That's so comprehensive. And I don't know if we know about that.
You know, a lot of our community are not aware of it. It's a program that we do refer. Doctors can refer, the community can refer, you can refer, anybody can refer someone to this program. In order to meet the criteria for SOURCE individuals, you have to have the traditional Medicaid, which your income has to be $841 or less. But also our sister program, CCSP, is the same Medicaid waiver program. If your income is over $841, you can also receive services as well.
Okay, so that's good to know, because I was so concerned, like, what if you're over that amount? So the first criteria is that you do meet the criteria for Medicaid.
Yes.
Okay.
You have to have Medicaid in order to be eligible. Now, we do have some members that also receive Medicare as well.
Okay.
But in order to be eligible for SOURCE, you would have to have the traditional Medicaid of your income being $841. And for CCSP, your income has to be over $841.
Okay.
But it requires a cost share. So depending on what your income is, and just kind of give you an example, if your income is $900.41, what they do is look at the cap, which is $841. So mine is that your cost share would be $100.
Oh.
But you still get those services, all of those services in your home, pertaining to having an aide to come and assist you, to help with meal prep, light housekeeping, assisting you with your ADLs. If you want to go to adult day center, if you want to receive the medical alert button. So you get all those services in your home, but even though you're still paying a cost share for it.
Oh, wow. So I'm thinking about a few people that I know, and maybe just if I can give you a case example,
Okay.
and how they would benefit from this. Let's say someone who's in their 80s or 90s,
Okay.
single or widowed,
Yes.
and they're needing some assistance, either cognitive or it could be even just physical assistance.
So anyone who meets those criteria in their 80s or 90s, and they may have early onset of dementia or Alzheimer's, if they are referred by you to say, well, you know, Shanice, I have this couple that are needing assistance, what we will do is our intake coordinator will give them a call and kind of do some intake screening questions. And one question they will ask, you know, what is your payer source? So they'll want to know if you have Medicaid or Medicare. and then they will ask pretty much what is their income. So if their income is over 841, they'll know which program to set that, that particular couple up with. But if their income is under 841, then they'll know. They'll be with Source.
Okay. So those are 80 and above. What about younger people? Sometimes they have some conditions that may cause them to have to need home health care.
Okay.
What's the cap, or what's the age, or how does that work?
Now, we do have, believe it or not, we do have children under the age of 18 on our program.
Oh, wow.
But again, it's based on a physical limitation that they may have and or a cognitive deficit.
Okay.
So it depends on what the nature is of their medical condition. We do have adults who are within their between mid-20s and early 30s. Normally those recipients are individuals who have maybe have had a traumatic brain injury. So we do provide services for, we provide service for the whole population.
Oh, wow.
Mainly our population do consist of seniors because we have a lot of seniors that live alone, especially those in their own apartments, their own home, or they're in a senior high rise. So it's good to have that service available to them. And a lot of our seniors who do live in a senior high rise, they have what they call as a service coordinator. Okay. So they actually have a social worker on site to kind of help and assist them. And we get a lot of referrals from the service coordinators as well.
We see that you founded something, an organization called Black Girls in Cyber.
So I started these Facebook Live series called Black Girls in Cyber, and I would invite different African-American women who were working in different aspects of the field to come and share their stories, very similar to as I'm doing now, and what their journey was, and to just really create more industry awareness around what this looks like.
Honey, what I think you need is a socket wrench.
I played JV basketball.
I'm sorry. I don't think it looks right.
This is good, and it's all good, baby.
Is it really all good?
If you love me enough to routinely test your handyman skills, not to mention the strength of your marriage, then of course you'll visit nhtsa.gov/therightseat to make sure I'm in the right car seat.
I'm gonna call my dad.
Today, I got something special for you. We're gonna be making a southern staple with some sauteed squash and onions. Okay, guys, our cabbage is just about done.
So again, this is Visiting Nurses Health System, and one of the arms, just one of the divisions, so massive. I love just the holistic care that you all provide, but this, of course, is community care. And we also have another division that's here, and that's home care.
Home, yes,
Home care, home health. Home health,
Absolutely.
it's just health at home, y'all.
Yes,
We gotta learn.
I like
Health at
that,
home.
health at home.
Yes.
Are you familiar? Well, no, we're all familiar with the term, it takes a village, right?
Oh, yes.
And when we think about that term, we think about it takes a village for raising young people.
Yes.
But actually that extends.
Yes, it does.
And I want to thank you, Pastor Cross, and House of Hope for having us here because you're continuing that mission of it takes a village by informing your community of all the resources that are available to them. So I thank you.
My pleasure. Our
With
pleasure.
Visiting Nurse Health System, as we mentioned earlier, has been here around for serving the community for 73 years, and will actually be 74 years today. Wow. And our CEO, Dorothy Davis, she actually set a theme for us as an organization that we stand for, and that's really, the theme is We Are One.
Okay.
And we are one as it relates with our operational practice. We are one as it relates to the patients that we serve, but we are also one with the community. And being here today just to kind of inform the community and joining with you is our honor. And to talk about home health. One of the things that I've seen over the years of being in home health, and I'm surprised to know that it's been so long. I've been doing home health care since the 1980s, doing it at a time when we were just trying to convince doctors that, yeah, we can do this at home.
Wow, yes.
So pretty much everything that you can do in a hospital, we can do at home.
Okay.
With visiting nurse, we have skilled nursing care, we have physical therapy, occupational therapy, speech therapy, and also home health aides.
Okay.
There are two terms that we hear often that sometimes it confuses people. We hear home health and we hear home care. Now, we are a home health provider, meaning that we provide what I'm presenting is the skilled part of our care. This is the part of care that you have to have a skilled need in order to get it, where it can be either, like I said, the skilled nursing or physical therapy or even speech therapy and our other services. Oftentimes, a lot of our clients, we get after a hospital procedure and they need additional assistance at home. Our visits are considered what you call intermittent visits, so we're in the home long enough to help you through the process, and we coordinate the care with a doctor's orders. And the plan of care is approved and worked out with your doctor. Now, the home health piece is connected to our private duty piece as well, and our private duty piece is more of the home health care piece, where you don't necessarily have to have a skill, but you would qualify for possibly maybe CNA home health aid support under our private duty department.
So I am just blown away by home health care. It's a whole system inside of our home.
Yes, it is. I like that. It is a whole system.
Yes.
Though what makes us unique, though, with Visiting Nurse, not only are we the largest nonprofit in Georgia, and we touch over 6,000 or more patients a year, we have the ability to connect with the community in a way where we're identifying and fulfilling a need. So not only are we out there providing the skilled care that you might need, we're looking at that patient holistically to see what service they might could benefit from. So a patient can start on one particular service or be in one department in our organization and can utilize two departments at the same time or progress or decline to other departments as they go through the process. So that, to me, makes us unique. And the mere fact that, you know, we have a CEO that stands firm on the we are one with our community and our patients, that's our drive.
I love that theme, we are one.
We are one.
And it feels like almost personalized health.
Yes.
That's what it feels like when I hear you. I'm hearing like personalized, almost prescription.
Yeah.
We call it
like-
patient-centered.
Okay, yeah,
Yes.
patient-centered. And I remember that from I was a CNA. Let me, back in my previous life, I was a CNA. So I remember patient-centered care.
Yes. See?
And this is just bringing it back to full circle, like, hey guys, we can still do this.
We can still do this.
And it works.
I mean, we have patients that get IV antibiotics, IV at home.
Wow.
We do wound care, diabetic management. Anything you can pretty much do in a hospital, we're doing at home.
In the comfort of their home.
In the comfort of their
Comfort
home.
of their home. And so it's just so, it opens up so much for me when I'm thinking about this. I'm thinking about even, like you mentioned, couples. Say someone is not able physically to manage or care for their partner, and that guilt that they feel, or maybe
Yes.
helplessness, you come in and provide that village.
Absolutely.
You create that village.
And family members, siblings, and sons and daughters whose role has changed.
Yes.
Where they have to be the ones to tell their parents what to do.
Yes.
That's another whole
Yes.
dynamic.
Yes.
So
Yes.
you need a system, you need a neutral party
Yes.
to come in and help with that, because that in itself is overwhelming when you have to tell mom, look,
Yes.
you know, are you taking your medicine, or, you know, mom is lashing out at you because you're telling her what to do, or dad is not listening to you because you're a baby girl.
Yes.
And now your baby girl is telling him what to do. So there are a lot of dynamics that go into home health.
Oh, I can only imagine broaching those conversations. They can be definitely tough. It's the loss of autonomy almost.
Yes.
That
And
the,
independence, yeah.
Yeah, the independence that the person feels, and then the child trying to interface with their parent and the roles that are
Role
kind of
change.
shifting. So that's a lot.
Yeah, we have a lot of our members and clients that receive services, and their children still have to work. So our community care program allows them to be able to be okay at work and knowing that their loved one, their mom or dad is at home in the care of a caregiver aide to make sure, you know, and monitor their safety, make sure that they're eating, make sure they're taking their medications, you know, while they're at work. So, you know, most of our members receive an 8-hour day of a caregiver aide in the home with them.
Oh, wow, yes. That does allow, like you said, the working person, where a lot of us are, and I know that boomers, baby boomers, and I'm not, and listen, I'm right behind them. We're the busters. We the busters,
We're the
so I'm right
busters.
behind you.
I
But-
think it caps off at 1957 or 6 or
Yeah,
something like that.
something like
birthday.
that, something like that. But the busters are right behind, and so there's almost a sandwich generation.
Yeah.
Yes.
Because then you have the builders who are above them, you know. So it's all of that care that's expected, and even that level of care. And so I'm thinking about what I was going to say about the baby boomers is they're going to be the largest population.
Yeah.
They already are, but coming to need health care
Absolutely.
and the system, right?
And we're living longer.
Yes,
I get
yes.
more and more clients who are 100 plus.
Yes.
You know, 102 and very cognitive. So yeah, we're living longer. So.
And our oldest member, she's 103.
Wow.
Oh,
And
bless her
sharp as a
heart.
tack.
Oh.
Sharp as a tack. Saw her last year.
What's her secret? Is she still with her secret?
She's just sharp. I don't know. She just loves the Lord, and she likes to eat her food when she wants to eat it. Writes Christmas cards.
Oh, that's
103.
Yeah, that's
So
good.
you're absolutely right. We're living longer. Our quality of life is better.
Yes.
But we're also experiencing things that I think as we're living older, there are more diseases and I guess things that people didn't have to experience because the life expectancy was so short.
Right, right.
Yeah.
And one of the things I like to tell my clients, oftentimes when they're battling between making these choices, feel comfortable in the point with the fact that you are able to make choices, that there are choices available to you. Sometimes we feel captive by, oh, I'm in this situation, I'm struggling now, instead of looking at the other picture, well, no, I'm being afforded these choices, let me see what's available to me now. And even if you don't need the service right now, it's always good to get the information so that you know where to turn when indeed you do need it.
Correct.
Absolutely. And so you mentioned the home health care, and I'm listening to community care. How do you interrelate? How do you guys combine?
We have a lot of shared members and clients because of, you know, our system itself within visiting nurse.
Right.
So a lot of our members, we may have members that are assigned or admitted to hospice. So they can also receive community care services as well.
Okay.
So community care is a program that will allow the aide to be in the home more than an hour, 2 or 3.
Okay.
As opposed to hospice, the nurse and the aide is only there to provide the care for that particular treatment.
Okay.
So for our program, you can have the aide in the home 5, 6, 7 hours. So that's the difference where it allows all of our programs to align. So it's almost like a community. And that's why we call it
Yes.
community care,
Yes.
to allow the services to be available to the member as a whole. So we may have a member who receives home health, hospice, and community care.
And,
Oh,
I,
goodness.
and I think maybe the
Yeah.
best way to explain that, we can give you a scenario.
Yes.
Right? So we have patient Doe who went to the hospital for a hip replacement. And post hip replacement, they need physical therapy for the next maybe 2 months or so. So the doctor orders home health physical therapy. So home health comes in, we do what we do as far as setting the physical therapy up. They come in maybe 1 to 2 times a week. They set up an exercise plan and program with that patient and their family, as well as with the doctor. So they do a plan of care so that patient is on physical therapy. So that same client might be a client that needs additional services in the home, additional aid support, maybe there are limitations. Shamice can kind of go into that, require that they get additional assistance for home health aides or CNA support, and they qualify for one of our waiver programs. So Shamice would have her coordination come in and set up. So they would be getting physical therapy from us, but then they would be getting additional services for this.
Oh my goodness, it's almost like a catch-all,
Yeah.
if you will.
Yeah, because if you have the physical therapy, then the member may have of course, issue with being able to ambulate on their own. So they need assistance with meal prep. They need assistance with light housekeeping. They need assistance with bathing. So that's how we can connect the two programs to be able to provide. It's almost like a one-stop shop.
Yeah. Exactly.
Yes, it really feels like it. I really feel good about my parents aging. I feel like I took some years back, added onto my life. Looking at my parents, I'm like, okay, what we gonna do?
Who do I call?
Yeah, yeah.
Yeah, but we don't know this, and I think this is so important. As if you're working with your aging parents, if you're aging, that these resources are available to help and to provide these resources for you. And I love how you're combining and working together. Like I said, so again, this is Visiting Nurses Health System. And this system is holistic. It's a village. It's just so needed and so necessary.
We see that you founded something, an organization called Black Girls in Cyber.
So I started these Facebook Live series called Black Girls in Cyber, and I would invite different African American women who were working in different aspects of the field to come and share their stories, very similar to as I'm doing now, and what their journey was, and to just really create more industry awareness around what this looks like.
Meet the Scan, a simple procedure whose mission is to detect lung cancer early.
I'm here to save you!
But I feel fine.
That's great, but you may still be at high risk for lung cancer.
Oh man, that's a new fence.
If you smoke, early detection could save your life. Learn more at savedbythescan.org.
Today, I got something special for you. We're gonna be making a southern staple. Now with some sauteed squash and onions. Okay guys, we got cabbage is just about done.
So again, this is Visiting Nurses Health System. And this system is holistic. It's a village. It's just so needed and so necessary. So necessary.
It really is, and especially during this pandemic.
Yes.
We have seen our enrollment increase by the nines, which is good because it allows us to know that, you know, the services are available and the folks need the help. So, you know, I like our system, how it's set up, because it allows families to just be able to stay with one program and know that you have hospice available, palliative care, you have home health, and you have community care. So the community care piece is almost like the catch-all, because we're there to be able to stay in the home with your loved one while you go to work, and so you can continue to care for your loved one and know that they are safe in the home and receiving that care. And now with the pandemic, it has allowed family members to serve as their own caregiver aide. The state of Georgia never did allow that, but now we have a system where you can serve as your own loved one's caregiver aide.
Oh, wow. And is there a training for that?
Well, you know, pretty much, you know, in our community, we always, we take care of our loved ones
Yes,
anyway. So
yes.
it's you learn it as you go.
Yes.
So it's just merely where you will be providing the care that you do anyway. Preparing their meal, helping them with their bathing, changing their bed linen, just taking care of them as a whole. So, and this has been a new service plan that I think has allowed the community to be more involved. Meaning, when I say community, family support to be more involved in caring for their loved one in the home.
Wow, and are they provided support and assistance as caregiver aides?
Actually, the actual family members get paid for it.
Oh, wow. Okay, that's good to know.
They're reimbursed. Yeah, it's a program where the state will reimburse them to care for their loved one, and it was something I think that occurred because of the pandemic and the staff shortage. So they had to figure out a quick
Yes,
fix,
indeed.
so that our members were not without service or services were interrupted. So if you have your niece, your granddaughter or your grandson in the home with you, you can be able to care for your family member and get paid for it.
Oh, you guys hear it. You can get paid to take care of your family member. Now listen, you got to take care of them.
Yes.
You got to take care of them. So, and it is a state program, so they're checking. So, but a beautiful, beautiful resource. Beautiful resource.
Yes.
I'm thinking about when it comes to home health care, what are some myths that we need to bust today?
One of the biggest myths is people feel like they have to pay out of pocket for that type of service, or they think it's for people who are rich, not knowing that home health, we're in network with most of the major insurance carriers, but we're also a Medicare provider. So we accept Medicare plans, Medicare replacement plans, and commercial plans. So there's no out-of-pocket cost for home health.
Oh my goodness, and I agree. I agree. Guess what, y'all? We don't have to be in Bel Air or up in Buckhead. We could be in Bankhead and still receive home health care. It's so I can definitely see that no, anybody can receive it, not just certain people. So this is a resource for all.
Yes.
When it comes to community care, what are some myths that are out there that you think can be broken today?
The only myth that I would say is we have, folks, well, I don't think I will be approved. And it's not about being approved because, if you are traditional Medicaid and or if you have Medicare, you still may be eligible for the services. Now, for Source itself, it is traditional Medicaid where you have to meet a certain income. But majority of our members do meet that. It's just a matter of it being approved by the state because once the nurse completes the assessment, it does go to our state reviewer for them to say yes or no that they meet criteria based on meeting a physical limitation or nursing home level of care. But majority of the times most of our members do get approved. They may receive a tech denial. And the reason why they receive a tech denial is because the state reviewer wants more medical information.
Okay.
And so once we do a reconsideration for that, they'll normally approve them for the services. So that's the only myth that I would say, I don't think I'll get approved for services. And I always say, let us try, because we won't know until we ask.
So we'll try.
That's it. That's so good. I want to make sure that we hear that. Try first. So let's not deny, let's try first. I want to let you know, or tell us a little bit more about community care, and just leave us with some final words about community care. Then we're going to come over to home health care.
Okay. Community care I've been a social worker for over 20 years, and I just love what I do. It's a program that will allow us to just enmesh and engross in providing care and service to population that needs the assistance. I am very big on the senior population. I grew up in the home with both grandma and granddad, so I'm used to being there to help them with anything. So I believe in advocating for those who need assistance and help. And that's what we do at Visiting Nurse. And it's just a awesome program to provide to folks to be able to remain in their own home.
So important. I'm so thankful for your passion. And I grew up with my grandmama and granddaddy,
Yeah.
so I get it. I so get it. And we want other grandmama and granddaddies to be at home and be supported, and that's what community care offers. And so home health care, I want to give you some last words to share with our community.
Well, home health care meets you where you are, and we care for you where you call home. And we're there to provide the skilled care that you need to get you back to where you're able to do the things you used to do. I do want to say, though, that accept and be present in your care, in life, and know that sometimes we have to define a new norm for us and not struggle with so much as this is what I used to do, this is how I used to do it, but be open to change, open to new ideas. And as we come into your home and provide the service, we're going to be working with you holistically to identify those areas where you need support and also provide those resources to help you be the best you that you can be.
That's so good. We want you to be the best you can be at the end of the day.
Yes.
We are one. I love that. I love that motto. We are one, and we really are. We're all connected. We're all connected. And so I'm grateful for both of you being here. Miss Beverly, Miss
Thank you
Shanice,
so
thank you
much.
both for coming on here
Thank you
and
for
sharing
having
these
us.
valuable resources that we need. And I hope that you tap into these resources. Let us know what you thought about these resources, your comments. We're so appreciative of them. Thank you for joining. And you can, again, share this. Excuse me, you've heard it. Now go share it with someone else.
Yes.
And we'd love to have this information out for you all. So again, thank you all both for being on the show.
Thank you.
We hope that you have a wonderful week, and God bless you, and God bless you. See you later.
See you later.
We see that you founded something, an organization called Black Girls in Cyber.
So I started these Facebook Live series called Black Girls in Cyber, and I would invite different African American women who were working in different aspects of the field to come and share their stories, very similar to as I'm doing now, and what their journey was, and to just really create more industry awareness around what this looks like.
Thank you.